Hello, everybody. Welcome to World According to Who, and we're here with David,
Hi, everyone.
our returning guest. Super excited to have you.
Good to I guess meet everyone again.
Yeah. And last time we hosted the podcast, it was just through Spotify, and so everything was just voice recorded. This time we decided to do video. It's going to be posted on YouTube and other platforms as well. So thank you for coming,
Thank you for
David.
having me.
Yeah. David's career, you wanted to share a little bit what you do?
Yeah, so hi everyone, my name is David. I am a behavioral health therapist at a psychiatric hospital outpatient clinic. So every day I do different forms of group therapy and individual therapy. So it's for people with like more of a acute need, but not as severe as inpatient services, but just they need a very prolonged structural support. So that's the population I'm working with right now.
Okay.
So providing different levels of like mental health therapy in group setting and individual settings.
I see. Okay. I think it would be a little bit nicer if you could move the mic a little bit closer, or you could, there we go. Yeah, the sound quality would be a little bit louder. Yeah. So today's topic, we're gonna talk a little bit more about men's mental health in this modern world.
Yeah, I think that's a pretty interesting topic and definitely a necessary topic to bring up.
Yeah.
Because I think even just in my experience seeing the patients in my setting, there's definitely more female than male who's receiving the support. And then I think we've discussed this kind of before, just like it's kind of hard for male to sort of wanting to get help because of how the society norm is, and then how we view the role of men, and then kind of just pushing them to be like, hey, you need to get all of it together, and then it might be a sign of weakness if you are seeking help. Yeah, so that can definitely be a way to like kind of pushing men away from receiving the help that they might actually need.
Yeah, definitely. And you being a therapist, you're definitely in the field, and you have put a lot of thoughts into it and observation. I host a lot of social events, and I go out there and meet people, and I have definitely encountered a lot of men nowadays who are dealing with social anxiety. They feel anxious, and I feel like the society, it's not as much out there to look after men. Or there are like so programs for men who are dealing with a certain type of trauma or anxiety or depression. I know it's awesome that women are getting lots of treatments, and there's a lot of programs for women. And I feel like we are quiet with our darkness. Men are not sharing with what they are struggling, and we're not really out there looking out for other men who are struggling out there as much. I feel like we are taught to be independent, to be strong, to be protectors. Those are great qualities, but there are also people who are dealing with situations that they needed help, and they needed therapy, and they needed the resources to help them get back up together. And so the stigma where guys are like, oh yeah, you're a guy, supposed to be strong, gotta like lift yourself up, that's good. But there are times like you probably needed a hand to help you get back up. It'd be a lot easier rather than just you figure everything out on your own.
I agree, yeah, because on top of the protector role, I feel like another reason might be shying men away from getting therapy is that a lot of the men are very goal and action oriented. They want result, and they want result fast. But then when it comes to therapy, one of the reality is that therapy is an ongoing, sometimes a lifelong work. It's very hard or challenging to see immediate results. Some people might be dealing with depression, and then they will receive therapy and take medication for years. And And they might only have the improvement of that. Now, when I wake up, I feel a little bit better. I can smile a little bit better. But those symptoms are not really going to go away. Because one thing some people might be misunderstanding is that therapy is not a cure. We are not trying to fix our patient with their problem. The main goal for therapy is for patient to become self-aware, know what their warning sign is, know when are things going bad, and then what are their coping skill and proper social support and resources that they can utilize to help them maintain on a baseline. And the more they do that, the better they get in terms of their reaching out and utilizing coping skill. The main goal is to just prevent them from decompensating and then needed a higher level structure of care. So this is something that we need to understand is that, yes, therapy helps. But unfortunately, it might not be the cure. That people think that, oh, it just fixed my brain, fixed my thoughts, fixed my sadness. We would love to, trust us. But sometimes it's not really how it works. So therapy can take a really long time to see progress, and then sometimes you just need a lifetime of maintenance as well.
Oh.
So for some men who are more of like, just get things done, I want to see the result, that might also be kind of a barrier to prevent them from seeking help, because sometimes they're just like, I've been seeing therapists for 2 months, why am I not better?
Yeah.
So this is something that the society needs to understand as well, is that we are not fixing people. We are teaching them how to manage their symptom.
I love that.
Better.
That what you just shared. It's so profound, and I feel like you just shared that the society needs to hear and understand what therapy is really about. It's not there to fix your problem. It's to help you learn about yourself, to become more self-aware, and you find through therapy you might find solutions to your situation, so you can better understand yourself and you can understand your emotion better. And so when things triggered you, you're able to capture yourself being self-aware. That's super important.
Yeah. So to give like a concrete example, so in my program right now, we have a patient who has audio hallucination. Means that he always hear voices, and then his voices are telling him to do things. He's been having this voice for 25 years. So sometimes even when he is in group with me, you can see that he's like having a conversation with someone who's not in his room, because that's how he responds to his voice.
Wow.
But when I had an individual conversation with him, we realized that, so he had this voice for 25 years. He is super aware. He tells me that, yes, I know this is just a voice, it's not real, but sometimes I just talk to him because I have developed a relationship. When I first heard my voice, the voice is telling me to kill myself. The voice is telling me to do bad things, and I was very scared, and I was like, maybe that's the end for my life. But with ongoing structural help of therapy, medication, and different types of treatment, now he knows how to manage his voice. So his voice is no longer a threat. Is in a way becoming a friend.
Okay.
Like an imaginary friend that we talked about.
Sure.
Like,
sure.
you know, for like some kids. But that voice is his imaginary friend.
Oh,
and then it's becoming more benign. Instead of telling him to do those bad things and hurt himself, he's having a relationship. But see, the point here is that his problem is still not fixed.
Right.
He is still hearing voices after 25 years of treatment, but he's able to manage better, and he's no longer having suicidal thoughts because of the voice.
Got it.
So that's how therapy works. Again, his voice is still there, maybe there for the rest of his life.
Sure.
We're not trying to fix that part. We're trying to have him develop a positive sense of what the voice can do to him or do for him and manage better.
Oh, well said. Yeah. Guys, we just had a basic understanding what therapy is about. And for people who are out there seeking therapy, don't expect the therapist to fix your problem. But therapist is there to help you learn about yourself better and help you find solutions and tools to you may help just become more healthier over time and prevent certain triggers. If certain triggers happen to you, you're able to be aware of what you're feeling, how you're feeling, what's triggering you, and then you could see a pattern over time with therapy.
Or even
consulting.
And on top of that, let's say if I'm being triggered by this like chess piece, maybe in the very beginning of my trigger, I will have a very like intense my body shaking, my heart is racing.
Yeah.
But another thing therapy can do is that because my trigger might never go away, and I might for the rest of my life be triggered by this chess piece. But if I receive structural help with ongoing therapy and practice my distress tolerance skill, maybe one day I can be like, oh, you just annoy me now, but I'm not afraid of you anymore. So again, my problem is not fixed, but I have learned the skill that I need to manage better so that it's no longer a serious problem in my life.
Okay. I remember you said that you have some stats that you... found out about you want to share.
So kind of going back to our male versus female receiving therapy, because if you read any article right now and then you see any stats, the trend seems to be telling us that more women are having mental health issue. More women are having those diagnoses, which is not wrong. But the problem is that's also an indicator that more women are seeking help.
Yeah.
Because we have way more women seeking help than men, it might seem that more women are having problems. Because according to the CDC, as of 2023, we have so for the last 12 months, by the end of 2023, we have 12.1% of women seeking some form of therapy versus 7.9% of men.
Okay.
So that itself is a big discrepancy. And then when it comes to medication management for mental health disorder, we have about 21.5% of women actively on prescription drugs for mental health versus only 11.5% of men who's doing that. So you can see just like even with the stats, it's telling that more women are seeking help. Because again, some men, like we talked about earlier, they just think it might be a sign of weakness. It might be a sign of defeat. It might be a sign of that I'm a loser that who just needs someone to talk to.
Right.
That's preventing them from seeking therapy.
Yeah, I can totally see that. Yeah. It seems like men tend to function that way where they, seeking therapy, it's a sign of weakness. I'm a man, supposed to be able to take care of it myself.
But kind of following up with that, there might be a lot of men who want therapy. And then there might be a lot of men who want therapy. But another factor I think is also worth the discussion is that there's a lot more female therapists out there.
There's definitely
in the
a lot
US.
of female therapists.
Because according to the National Institute of Mental Health, as of 2023, we have roughly about 200,000 therapists, like licensed therapists in the US. Out of those, only 24.4% are men.
Okay.
So meaning that we have a lot more female therapists out there, which is not a bad thing. But sometimes some men might only want to talk to men regarding certain topics.
Oh, right.
Some that's very sensitive and male-focused topic, like maybe erectile dysfunction, infertility, struggle of being a boyfriend, struggle of being a husband, a father, how to be that role of men. And then it might be uncomfortable to talk about those with a woman.
Right.
Because they feel like maybe, men will understand this better. Or, if I'm just talking about this to a woman, it's more awkward.
Right.
So, on top of that, if we have less male therapists who are available to see male patients, that could also be another factor that's preventing men from seeking therapy. Maybe they genuinely want to start therapy to try it out or to start trying to focus on their own problem. But the possibility of not finding a man therapist could also be a factor in this case.
I remember when I was in college majoring in psychology, I would say like about 70-80% of the classmates are female. So there are more women psychology majors than men. Usually guys are majoring in, let's say, computer science,
STEM,
engineering,
focused,
and those areas. Women tend to major a lot in psychology.
And even in my experience, so when I was interning with the same psych hospital inpatient, I would say our class has probably 40-ish intern, 40%. And out of those 40, there's only 4 guys.
Oh, wow.
And in my current work site, I am the only male therapist out of the team of 11.
Yeah, that makes sense. Yeah. So the patients that you see, what is the ratio of female versus male?
So in my caseload, I have caseload of 10 patients, and it's like 7 female, 3 male.
7 female, 3
Yeah,
male.
but then when it comes to the entire hospital, I don't have the actual stats, but I believe it's more female compared to male.
Yeah, I believe it. Yeah. So what do you think the solutions are for men to receive help?
I think it's hard to dwindle down to one specific solution. I think a lot of steps needs to happen for a trend to occur.
Yes.
Because first of all,
this will be one of them. Yeah.
So first of all,
having
a conversation. So definitely we need to invite more conversation like this. Because see, long time ago, mental health was a taboo of topic when it comes to the US. People don't talk about it.
I mean, it's taboo in Asia, right?
It's taboo in Asia, but it's also a taboo in the US not too long ago. But look at us now. We are having more conversation. More people are getting help. To kind of share another like stats to support that, according to the American Psychology Association, in the demographic of people aging from 35 to 44, in 2019, 31% of them received a mental health diagnosis. But in 2023, that number jumped up to 45%. Sure, that means that more people are having mental health issue, but at the same time, it means that more people are getting the treatment. 31% people were getting treatment versus now 45%. So definitely more is happening, and more people are realizing the conversation, the importance of therapy. But when it comes to like how we apply that to men, first of all, is to help us so take away the stereotype.
The stigma.
Destigmatize.
The stigma of
therapy.
Men not seeing therapy, men supposed to be self-reliant and be able to take care of your own.
We need to understand that therapy is not a sign of weakness. In quite the opposite, therapy is actually a sign of braveness, of courage. It's you recognizing you have an issue and you're willing to try different things to solve it, or to try to be better at managing your own issue. This is how we should see therapy. It's not a sign of defeat. It's a sign that, okay, things are not working out right now. I accept that, so let's find different solutions.
Right.
Some people might still rely on themselves to be the solution to solve the problem on their own. That's okay.
That tends to be me most of the time.
But just know that there are other options in the forms of therapy.
Yeah,
it's
and
not,
everybody functions a little bit differently.
Some people might be able to like manage on your own.
I tend to be very self-aware, and I do journaling every single night. I focus on my fitness, focus on my inner development, and then my career. So I journal that before I go to sleep. And so self-awareness, I'm pretty aware. And also I talk to my close friends and family members, and we do like a moment of reflection at times. And so I love to learn about myself, how I interact with other people, how I deal with stress. So, journaling, in a way, it's also really good therapy.
It is a form of therapy because that is a very healthy way to help us express ourselves.
Yeah.
Because
really good way to get to know yourself.
Yeah, because another factor I think is preventing men from seeking therapy or anything is that they don't feel comfortable expressing themselves, they're not comfortable to reach out for help, or they're not comfortable to share their struggles.
Right.
Because again, going back to the stigma and signs of weakness, just like men should always be the protector, men should always have it together. So if you're telling someone you're struggling, you're just a loser.
Right.
And that's the conversation we need to have as well. That's the stigma we need to change.
Right. Yeah. It's
reaching out for
normal for you to seek help.
Yes.
And let people know your challenges, because we all go through that. We all have challenges in life.
And sometimes you might just simply want to be heard, because when you keep building up those stress and struggles inside of you, and you just keep letting it build up and up without a proper way to express or process, it's going to get you one way or the other.
Yeah, it sure does.
Because let's say this, we all might feel down every once in a while, right? We all say, oh, we feel depressed. Sure, that means that you might not have interest in doing something. You might be overtly tired. You might lose appetite. You might notice some hopeless thoughts. Yes, we feel depressed here and there. But if we don't process those and let those feelings consistently grow and grow, guess what? If you consistently have those symptoms for at least 2 weeks, you might be quote unquote qualified to have a diagnosis of clinical depression or major depressive disorder.
Mm. Hey, what do you think, being a therapist, you have a lot of guys coming to see you. What do you think the typical reasons they are seeing therapy?
So, well, in my case, again,
But you also work in a clinical, like a hospital, which is very different than at a university.
Like private practice in a way.
Yeah, yeah, it's quite different.
Yeah.
Maybe yours is much more like higher level
yes.
of intensity.
So in my case, many of the patients who come to us because they kind of have to. They are what we might consider a risk if we let them out on their own.
I see.
So they might just be very disorganized, very potentially violent, and then very depressed, that if we let them out on their own without the proper structure, they can cause some damage to themselves and other people. So in my hospital, it's actually kind of like necessary for them to come, so we keep them stable.
Got it. Are they violent?
Not in our program, but when I was inpatient, we definitely have some people who are violent. So if we let them out, they might be in jail instead.
People. Oh, I see. Okay.
So it's like either us or jail, or us or morgue.
Yeah.
So we are a platform and resource for those patients to stabilize, to not decompensate, to be able to manage to the best they can with the help from us. But in like general, like private practice, just say people, I have a colleague who also works at private practice, and she tells me that sometimes people go to her for a lot of reasons, maybe just like, oh, I broke up with someone, I'm sad, I need to talk to, and then, or I feel so lonely, or I failed an exam, or I feel like no one listens to me, or I feel like I am not making friends. So like we see a lot of people. Maybe all of us need some form of therapy. We just might not be aware of it. Because again, sometimes we go to therapy, maybe just simply we want to be heard. Yeah. It's just a part of us that is struggling. And
I like to be heard, so that's why I post a lot of shit on Instagram, and now I have a podcast.
So that's you,
that's my therapy.
Yeah, but that's you being self-aware, right?
Yeah.
That's you being self-aware, and then sometimes doing things like this is a healthy way to express, because we do need to have an outlet every once in a while.
Sure, yeah.
For me, I have my own therapist, and then I play soccer. That's how I express all of those stress I have.
Is soccer your main source of treatment for yourself? Or you have a therapist yourself?
I do have a therapist myself that I see weekly, and then I play soccer, kind of just like my way of expressing myself, or it's an outlet for me to let go of my stress.
Yeah, I remember when I was in college, I hear people said that usually a lot of psychologists, they see psychologists themselves.
It's actually not a requirement, but highly recommended. Like every therapist needs their own therapist.
Because you deal with a lot of pressure, every single day.
And also, see, for me, I can diagnose myself. I know exactly what I need to do to get better.
Yeah.
That's the therapist side of me. But I am also human.
Right.
I also have my own weaknesses. I also have my moments where I just don't feel like I can carry on.
Yeah.
So that's why I need my own therapist to kind of hold me in that situation, to guide me through my own problem.
Got it.
So I can be well enough or stable enough to see my own patients. Yeah. Because if I am just struggling and not seeing therapy and just let myself then I am not being responsible to my patients. Right. I am setting a bad example.
Yeah, because you have to be healthy yourself in order to help your patients.
Exactly.
My form of therapy is go to the gym and smack the punching bag.
That is actually that is actually one of the most effective coping skill is exercising. Because when we exercise, we release endorphin and we release serotonin.
Yeah.
The higher serotonin level we have, the better we are able to manage anxiety and depression. Yeah. And then endorphin is a type of neurotransmitter we call a feel-good neurotransmitter. So the more we have it, the more we are able to feel good or feel stable.
Yeah.
And then sure, there might be some type of medication that can boost those two neurotransmitters, but we can also get them naturally through movements and exercises.
I mean, like, I work out every single day, go to the gym, I do my kickbox. Like today I did kickboxing, did my core, chest, push-ups, I did my leg press, chest, core, back, leg press, kickboxing, and did some push-ups. Did 100 push-ups today. And then I do a lot of yoga and hit the sauna, sweat it out, and feel great every single day. And also the type of food that you put into your stomach is also very important.
Yeah.
I notice that sometimes when I eat like a heavy, delicious burrito or like a big bowl of rice, it tastes really good, but afterwards I start to feel a little bit sleepy. Since I got on this diet, I have been feeling pretty good.
Yeah.
My energy level has always been really good.
So see, those are what we call coping skill, right? It's the different things that can help us feel better when we need to.
Yeah.
But another thing to kind of clarify is that coping skill does not solve our problem. It does not make us not sad. It does not make us not angry. Because yes, when you are feeling down and angry, we need some form of coping skill to help us to reach more stability. But so here's an example. Let's say I got mad at this chess piece again. I can use some coping skill. Let's say I can go play soccer, I can go work out, I can listen to some music to help me feel better. Those are my coping skill.
Right.
But what they do is not solve this issue, because no matter what I do, this freaking chess piece is always gonna be here freaking me out and like irritate me. But when I'm able to do my coping skill, what I'm doing is that I am actively choose not to pay attention to my trigger. Instead, I am paying attention to something that's more productive, that I like, that can bring me joy, bring me a sense of positivity. When I do those, my focus is somewhere else, not here.
Yeah.
The problem is always still going to be here, unfortunately, but when I use my coping skill or talk to someone, I am focusing on something else, not my trigger. And then using my coping skill to help me feel better, help me regain my composure, then I can try to come back and be okay with this, with my same trigger that was giving me a lot of hard time earlier. So again, therapy...
Did it really give you a hard time?
No, I'm just making an example. So again, therapy and coping skill, they're not about fixing your problem, but just teaching you how can you manage those problems better so it doesn't affect you as much as before.
I like it. Well said. Okay, we learned a lot today. Yeah. Do you have anything to add before we end?
Kind of just continue to add on to the conversation that men, women, anyone out there, it's okay to seek help. It's okay to receive therapy, to talk. Sometimes just hearing your own problem from a different perspective can be very eye-opening. I really encourage you to give it a try. Just, again, it's not a sign of weakness. It's not a sign of defeat. It's actually a sign of you being brave enough to invite someone else to share your struggle, to invite someone else to share what you're going through, what you're having a hard time with, and then try to be better at it. And I wish more and more conversation like this can happen, and then more men can feel safe and okay and not being judged when they want to better themselves through the form of therapy.
Yeah, I love it. And when you're seeking help and you want to talk to somebody, find someone like David. He is a good listener. He actually really cares about his patients, about his friends. And finding someone like him that won't judge you and actually encourages you, it's very helpful. Because if you talk to the wrong person, that can actually escalate into even a worse situation for yourself.
Actually, thank you for bringing this up. This is another thing I want to say. Sometimes you might not find your perfect therapist on your first try. Kind of seeing it as dating, right? You might need to go through a lot of different dates to find the one right person who you can spend the rest of your life with. Same thing with therapy. There might be some therapists specialized in different areas, but they are not what you need. You might see one therapy have one session be like, I don't really like that. It's okay, because it's like we need, and and know that there are other options out there. So don't feel like you have to just stick with one therapist for the rest of your life on your first or second try if they're not working out for you. You need to find the right therapist, so then it can be a lot easier. If you stick with someone who just don't get you, or who is not the style you enjoy, or who you just simply cannot stand, then we're actually adding more stress to you. So say if you come see me and then you realize that, wait, David knows this part, but it's not what I'm looking for. It's okay to fire me and then find someone else. Again, when you find the right therapist, you might work with them for a very long time, sometimes if not lifetime.
Wow.
So really find the right therapist for you before you continue to unload all of your stress. Because I know it's uncomfortable to tell your struggles to people, especially when you have to tell over and over again. That's why when you find the right person who can keep guiding you to unload, who can keep guiding you to realize the core of the problem, that's when the progress starts.
Well said. Well, thank you very much, David.
Yeah, thank you, Sean, for having me. This is
Yeah.
a really nice topic, and
Yeah.
I'm really glad that you are having this discussion on this
Really
platform.
enjoy it.
Yeah.
And we're gonna have more topics in the future that we're gonna talk together. And thank you for listening and watching our video. Please like, subscribe, like other YouTubers said. See you later.